So now we want to look at the basic ECG interpretation so that we can be able to know when we're having a normal rhythm or not. So as we said, let's look at the P. We'll look at the P, the P wave and how it looks. We'll look at the PR interval and it also signifies. We'll look at the QRS complex. The J point, which is very important, especially when it comes to myocardial infarctions. And then we look at our ST segment and also our T wave. Yeah. So let's look at our P. Our normal P, yeah, you can see from the way it looks, it should be round. Yeah, nice rounded. It's a nice rounded shape. Yeah, and it should be upright. Yeah. This is the P wave is whereby when we have the when the atrials are contracting, and this is when we say atrial depolarization. Yeah, this is whereby the atriums are contracting, so that the blood now can move from the atriums to the ventricles. Now the PR interval. Remember we talked about there's the SA node and we have our AV node. So this is the time. Yeah, that the blood is moving from the atrium to the ventricles. Yeah, and usually there is an interval. You remember we said our AV node is actually the gatekeeper. Yeah, this is very important because if this is either lengthened or shortened, it will affect the rhythm of our heart. Yeah, so we also need to look at our PR interval. Then we look at our QRS complex. This is whereby when the ventricles are contracting, yeah, you can see it's actually a complex. It is that because the ventricles are big, yeah. So it's actually the muscle, the ventricle, the muscles of the ventricles are big. So it actually, when they contract, they're able to give us a complex. They're able to see how they are contracting. And then we have the ST segment. This is a segment that is very important, especially when we're having myocardial infarctions, which we are going to look at. When it is elevated, it is now telling us there's something going on, yeah, to the heart. There may be some blockage, there may be some narrowing, so we are able to know what could be going on. The joy point is this is a point that is important, as I said, when it comes to myocardial infarctions. It's able to tell us, we are able to know from which point are we able to see to gauge our elevation. Yeah, so we usually count from the J point to the point at which it starts curving. So we know that there's an elevation. And then we have our T. Now our T is whereby it comes about when the ventricles are relaxing. Remember earlier when we talked about how would we know whether our atriums are also relaxing? It's actually swallowed up in the complex. That is why we are not able to have a wave to show us that the atriums are relaxing, because it's actually swallowed up in the complex, which is, as we said, it is a big muscle. Then we have our U wave. This is whereby the myocardium, the Purkinje fibers, yeah, are actually relaxing, yeah. They're actually relaxing, and you can see at the apex of the heart. So you can be able to see these either in V2 or V2 to V4, yeah. You may or may not see it, yeah. But when you see a small wave, then usually that is usually our U wave, whereby the apex of the heart, whereby the electrical conductivity is initiated by the Purkinje fibers. So it's when they're relaxing, so it's able to actually give us a U wave. So that's basically how you're able to know what's going on in the heart. And as you can see, this is in a normal sinus rhythm. Yeah, you can see we have our P, our QRS complex, followed by a T, and then you have another P followed by a QRS complex. That is how you want it to be, that's how you want a normal sinus rhythm to be. It has to be followed up as it is clearly demonstrated here. Remember, we talked about our RR. This is usually we use the RR interval when you want to know whether our rhythm is fast or slow, and you're able to easily do this when you look when you want to know whether, as I said, if it's a fast, if it's a regular, or an irregular rhythm. You can be able to use your RR interval if you want to count the beats, the beats per minute in a strip. You also are able to use it, because what happens if you want to know whether your rhythm is regular, you will actually take a paper, as I said, and you will mark from one hour to the another, and you will move it across, yeah, on a strip. If it falls on the marks that you have made, then you know that your rhythm, your strip is regular. Then if you want to count, yeah, maybe if you have a machine that does not count for you, yeah, because some of the machines usually tell you that this your heart rate is at 60 or 70 or 80. So if you do not have that, and your rhythm is regular, then you can be able to count the big boxes in between one hour to the next. So when you count the big boxes, so you'll do it, you will divide by 300, and you'll be able to know approximately your heart rate, yeah, on the strip. So as we said, when you look at your strip, you want to know whether it is regular. And as you can see, that is a regular rhythm. It has a P followed by a QRS and then a T. Yeah, usually we like using the lead 2 to be able to look at, to be able to know whether your strip is, your strip is regular or not, because it has a longer, it gives you a longer reading on it, yeah? So you're able to move. As you can see, it actually is a full, it has a full, the full strip is actually on lead 2. So you can be able to easily count and see whether your rhythm is regular or not. Now, when you look at this, yeah, you have your strip. I mean, you have your small paper that you have marked from R to R. Now, when you look at this strip and then you compare with that strip, yeah, like for this one, it is the big box. If we are to count the big boxes, it's 1, 2, 3, 4. There are 4. The next one has 1, 2, 3, 4. Yeah, as I'm looking at the lead 2. So if you count, you'll see there are actually 4 boxes. Yeah, approximately 4 boxes between one hour to the next. When you look at this one, the first hour, from one hour to the next, you look at it, you count 1, 2, 3, those are 3 and about 3/4. Then the next, from 1 hour to the second hour to the third hour, 1, 2, 3, 4, 5. You can definitely see that there's already an irregularity of that rhythm. So you'll be able to know that when a strip is regular or irregular. As we said, we want to look at whether our rhythm is sinus or non-sinus. Remember, we said it is sinus when the electrical conductivity is from the SA node. It has to come from the SA node. If it does not come from the SA node, then we say this is a non-sinus rhythm. Yeah. So that you will know that it has either come from the AV node. Now, we know that our normal heart rate is usually 60 to 100 beats per minute. That's the normal heart rate of a patient. When we talk about things like fast rhythms that maybe are non-sinus, yeah, those ones when we say that when they most likely they may be very fast, and like when we say a rhythm may be supraventricular. So that means we cannot really say, is it coming from the SA node? Remember our SA node, it has to have that regular rhythm. It has to have that rhythm of P. It has to have a P followed by a QRS, then a T. If it does not have that, then you definitely know that it is not a sinus rhythm. We said our P wave, it has to be upright, yeah? And when you look at our rhythm, usually we see them upright. Now we look at our leads. It's good to know in which leads, when we're looking at it, how the P wave should it, because if you look at some of the leads, you can find that could be that the P wave will not be upright. But when you look at a normal sinus rhythm, the P wave should always be upright, as in lead 1 and 2. And then, as we've said, that each P wave is usually followed by a QRS complex to be able to know whether it is a sinus or whether to know that it is actually a sinus rhythm. So, as I've said, you can have a normal heartbeat. The first strip, that is actually a normal heartbeat. Yeah, the normal heartbeat of the patient should actually be like that. You can clearly see it is a P followed by a QRS, then a T. Then look at the second one. Now, can we really be able to know, is there a P? Yeah, we can't be able to know whether there's a P in that, the second rhythm. We can clearly see there's a QRS, but we cannot know whether there is a P. And remember, we said in a sinus rhythm, we have to have the P wave very well elicited and then followed by a QRS. So when we have an irregular rhythm like that, then usually we have a condition called atrial fibrillation, yeah, whereby the heartbeat is irregular. And the unfortunate part, when a patient has an atrial fibrillation, then that means that the heart is just quivering. Yeah, you remember that when the heart is beating, it's actually timed. Yeah, so when this does not take place, and the heart quivers, that means there is inadequate emptying of the atriums, yeah, the blood from the atrium to the ventricles. So what happens is that there's stasis, yeah, the stasis of some blood, and that is very dangerous, because what happens that we end up having clots. And the clots are dangerous, and so when you get patients who have atrial fibrillation, they're at risk of things like stroke and myocardial infarctions because of the micro clots that are formed because of this condition. Now we look at our next rhythm, yeah? We want to ask ourselves, is this regular versus irregular? Remember, we said when it is regular, we look at our boxes, yeah? An easy way, we look at our boxes and we want to use our lead 2. So you want to count the boxes between the first R with the next R, and then you move across to the whole of the lead 2 lead. When you look at that, you'll actually look at the first lead. It is 1, 2, 3, 4. The next one is 1, 2, 3, 4. And you look at the next one, it actually also 4. So that means that is a regular. You remember your small paper, you have marked 1 R to the next and you move across. If it falls on the markings, then you know then that is a regular rhythm. If it's not falling on that, then you know that that's an irregular rhythm. We look at it as the same as we've said. Use your paper, count with the lead. We'll use our lead 2 because it has a longer strip, and it will show us that for sure that is an irregular rhythm. Yeah, you can actually try and look at it. Use your markers and look and try and see whether that is regular or irregular. For me, for sure, that is an irregular rhythm. It has got no regularity in it. Now we want to look at the cardiac axis. The first thing I want to say is that the most important thing to know about the cardiac axis, this is the path that is followed by the electroconductivity. Yeah, it's like the path that the conductivity follows in the heart, and how you're able to know whether whether the heart is actually turning to the right. Yeah, because actually the electroconductivity affects how the heart may turn. Yeah, so it actually is able to tell you whether is the heart turning to the right, is the heart turning to the left, or is your heart in the normal axis. Yeah, when you look at the heart, is it normal? And a very easy way to be able to look at this, and we said from the beginning, we said what we are dealing with is we want to have the basic knowledge, yeah, to be able to know whether our ECGs are normal or whether they are abnormal. Yeah. So we will not go deep into the degrees of the axis, but the most important thing is to know, are we having a normal axis? Are we having a left axis deviation? Is the heart turning more to the right, or is the heart turning more to the left? This is usually used a lot by the cardiologists when they're trying to make some different diagnoses on a patient. So when you want to know, for me, what we usually do, for me as an emergency nurse, the easiest thing for me to be able to know whether my patient's heart, the axis that my patient's heart may be having. So if it is a normal axis deviation, I will want to look at my strip, and I want to look at my lead 1 and my AVF. Yeah. So when it is when it is anormal, when the patient's axis is normal, then I will look at the QRS complex of my lead 1 and my AVF. If my lead 1 is actually positive and my AVF QRS complex is positive, then I know that's a normal QRS. That's a normal axis. Then if I'm having a right axis deviation, what comes into my mind, I will think about, remember algebra? In primary school, you look at the X and Y axis. It is the easiest. Yeah. So you look at and you'll use your hand. You know that there's the X, when you're using the X and Y axis, you know that you have the negative side and the positive side. So if I'm having if I'm having a right axis deviation, I will know that my lead 1, because I will look at my hand, it falls on the left side, of the X and Y axis. So I will know that the lead 1, the QRS, should be facing downwards. Yeah. And my AVF, which will be my left hand, should be facing upwards. So if I'm having a left axis deviation, then I should have my QRS complex facing downwards, and my AVF, which is on my left side, should be facing upwards, which is on the positive side of the X and Y axis. If I'm having a left axis deviation, then I will look at also still my left axis deviation, and I know that it is the opposite of the right axis deviation. So the left axis deviation, my lead 1 falls on my left hand, which is in the positive side. So that means the QRS complex should be facing up, and the AVF should be facing downwards. Yeah, so they actually come together. So that's basically how I'm able to look at my strip and know that, is my heart in the normal axis? Is it right axis deviation? Is it left axis deviation? I would like to encourage people, kindly just go into YouTube. There are easy ways on how to be able to know the axis deviations, and you can be able to pick which one is easier for you. For me, that is what I use, and I find it very easy, and I do it within minutes after I do my ECGs, and I'm able to know whether it's a normal, a right, or a left deviation. So let's look at that. We look at our, as I said, we'll look at our lead 1 and we look at our AVF. We look at our lead 1. Our lead 1, our QRS complex is facing up. We look at our AVF. Our QRS complex is facing downwards. So that will mean that this is a left axis deviation. Yeah, it's that simple. You look at your lead 1 and you look at your AVF. You'll know that that is a left axis deviation. Let's look at another one. Look at that one. Lead 1. We look at our lead 1, our QRS complex is facing downwards. We look at our AVF. Our AVF, the QRS complexes are facing up. So that makes it a what? A right axis deviation. because you're using what you use the X and Y axis, you know that your left hand is on the negative side and your left hand is on the positive side. And that's how I'm able to know whether that is a right or a left axis deviation. So I hope that was a brief on how to be able to know the axis deviation and how to be when you're able to look at an ECG quickly, you're able to interpret it quickly, because that is what you need to do. Because once you do your ECG, you want it to be interpreted within the first 10 minutes. You want when your patient comes in, you've done your ECG within the 10 minutes and it's been interpreted within the next 10 minutes. And you're able to know whether your patient whether it's a normal ECG or it's an abnormal ECG. You do not want to take too much time on it. We had gone through that on the segments and what they also mean. So we go back in looking at the characteristics. As we said, it has the P wave should be round, as you can see, as it's clearly shown in our presentation. It shows that it's nice and it's well rounded. And that means that the electroconductivity is coming from the SC node. As we said, it's able to tell us that there is the contraction of the atriums, which we called atrial depolarization. Yeah, and to know a normal, it's we look at the small boxes. When you look at our ECG strips, we have small boxes and big boxes. So we want to know whether your P wave is actually normal or abnormal. Yeah, so when you look at your P wave, you want it to be less than 3 small boxes in duration, yeah, on how long it takes. And then you also want to look at the length, the height, yeah, that is the amplitude, which is also, it should be less than 2.5 small boxes, which you're able to really to see clearly as in a rhythm strip. And then you want to look at your PR interval, as we talked about it. This is the time that's between the onset of the atrial depolarization and the onset of the ventricle depolarization. So as we said there, you want that interval to be there, so that you have complete emptying of the atriums, yeah, so that the blood is able to move well from the atriums into the ventricles. So we usually we have a duration, and to easily be able to know the duration, which is 0.12 to 0.20 seconds, which is 3 to 5 small boxes. And from a normal strip, you're able to easily count that and be able to know whether your PR interval is it shortened or is it lengthened. And you'll see a lot of that, especially when you're having a blockage, yeah? Where if it's lengthened, then you'll see there'll be a block in the pathway. Yeah, you remember how we went through the normal electroconductivity. So when it's lengthened, you're able to know that then there's a block. There must be something going on. There must be an occlusion on the pathway. So it will definitely be lengthened. And then now we have our Q waves, yeah. This usually we are able to see you can have, when we say pathological, we mean that there could be some disease. It could be, they may be having a problem, yeah. So when you're having a diseased a diseased Q wave, you will definitely see that when the patient may have had a myocardial infarction. So you'll be able to see that it's quite deep. But when it is normal, yeah, when it is normal, because in our normal strip, you will have Q waves. You usually have Q waves, yeah. So then to be able to know whether it is normal, then it should be less than 2 small squares, yeah, deep, and less than 1 small square wide. You see the way it looks, yeah, from the normal strip that we had. So it's supposed to be less than 2 small squares deep Yeah, you remember where the Q is. It's right after the P, and then you move to the Q arrest complex. So it should be for it because when you look at a strip, it's actually it has a bit of negative deflection, but it should not be more than two small. It should not be more than two small boxes deep, yeah, in its deflection, and then less than one small box wide, one small square. It should also, you look at the widening of the Q wave, and you will see the difference when you look at the pathological Q waves. So it's good to know what is normal and what is abnormal. So that is a rhythm that we can look at. And I want us to look at our Q waves, yeah, from the strip. Let us look at, for this strip, you can see we have the lead 2 that has a longer strip, and then the V5 that also has a long strip. When you look at the Q, when we look at our, let's look at our Q waves. Let's look at our Q waves. How do they look? Are they normal or are they abnormal? Yeah. So there's deepening of the Q waves. Yeah. So I want you to put that in mind, and when you go through the next strip, and so we can see, are they pathological or are they non-pathological? Yeah. So let's look at them. Let's look at another one that is quite clear than the initial one. We look at our, let's look at the Q waves in lead 1. Yeah, look at them. They're quite deep, as you can see. Yeah. Look at the ones in lead 2. Yeah. They're quite deep. So with that, we will be able to know whether that there may have been something going on with the heart. So when we have a Q wave, when you have a pathological Q wave, this is whereby we have a patient who may have suffered a myocardial infarction, who actually suffered a myocardial infarction. And once they suffer a myocardial infarction, then a Q wave, usually, because when as it heals, it forms a scar tissue. Yeah. And as we said, what we are able to see it very well, whereby we have the complex, which is the QRS. So we're able to know, we're able to see that something may have, it's able to be elicited very well on a rhythm strip. So you can see the QRS are quite deep. Yeah, we said it should not be more than two small boxes deep, and not more also than two small boxes wide. You can see clearly we are having Q waves that are quite deep. And that, as you see, that's how you're going to see it when a patient has suffered a myocardial infarction. Then we look at our QRS, how it should be. Yeah, so usually it's up. In a normal sinus rhythm, the complex should be upright. The QRS complex should be upright, as you can see. Yeah, and then the complex in between, as you can see, in the complex in between it, where the V is, it should not be more than two. The normal is 2.5 small boxes. So when you look at your strip, you'd want to count: is it narrow, is it wide, or is it normal? So to be able to know your normal, it's usually approximately 2.5 small boxes when you're able to count. And then this is just ways of the wave of depolarization, how it occurs. Yeah, as it moves from the QRS complex. Yeah, the shape of the depolarization, and depolarization, you remember, it means contraction. Yeah. So this is the rhythm it follows. So it tends to look like that until at the end, whereby it usually comes to be upright. Yeah. And then to be able to know, as we said, they look different when you're looking at different leads. So as you can see in lead 1, in V1, it will look as it is been shown clearly. In V2, you can see they're actually not upright, but they are normal. So it also depends on how you're looking, on which lead you're actually looking at. So it's good to put this, it's good to have this at the back of your mind when you're looking at your strip, to know that if I'm looking at V1, if it's not upright, then I should not be worried and say, oh my God, it is abnormal. So when you look at each lead, it's elicited differently as it's clearly been shown. So that's also a different strip, yeah, on how it looks. You can clearly see, yeah, your QRSs, they look different as we have explained previously, that it will depend on which lead that you're looking at. So it's good to know. So when it is now, if you look at it in V6 and it is not upright, then we know that there's something going on. Because now, for me, I have looked at the V6. If I've looked at V6 and I look at my QRS and my QRS is not upright, then there must be something going on.